Okay, let's talk about some rare but scary things that can happen at the end of life and why you should learn about it. So it's important for me, I think, to talk about the good, the bad, and the ugly parts of death and dying. For the most part, I do feel like I share with you that end of life does not have to be scary. And a lot of the things that you see aren't scary, they're normal. Now, there are, though, some abnormalities, some rare things that do happen that I can completely see why you would feel that they were traumatizing or hard to witness. And I think it's important to talk about those moments too. So let's get into it. So first I want to talk about the fluids. Now, seeing fluids coming out of your loved one's mouth at the end of life is not necessarily abnormal, but I still wanted to bring it up because many people ask me about it. So why does this happen? So a lot of times the fluid can be black, green, yellow, sometimes even foamy. That fluid is likely coming from the stomach and is likely stomach bile. Now, why does it happen at the end of life? We have sphincters that keep all these fluids where they should be, and when we die, they relax. Or when we're dying, they start relaxing. And then you start seeing people have regurg, and things like bile, like black fluid or dark green fluid, will come up and out of the mouth. It is normal, but not the greatest to see, and it's really not great if you don't understand what's happening. So when that does happen, you would just want to let your hospice and palliative care nurses know so we can try to help treat the regurg, but also you can just sit your loved one up or sit them over on their side so the fluid can just come out. Again, it is not pleasant to see, but I think education can hopefully decrease the fear a little bit. So the second thing is intractable nausea and vomiting. Now, what is this? This means that someone has persistent nausea and vomiting, which can be horrendous to deal with for the patient and for their loved ones caring for them. So this literally just means they cannot stop feeling nauseous. They cannot stop vomiting. It happens in certain diseases, anything in the abdomen area or the pelvic area. If there's tumors in the small bowel, if there's any kind of small bowel obstruction that they can't fix because they can't have surgery or because there's a tumor there, there's many, many reasons for it. It really doesn't happen to many people, but it does happen. So when this happens, it's what you think. They continue to keep vomiting, continue to keep feeling nauseous. Now, the worst thing that can happen if this was happening would be to have a small bowel obstruction, like I said, which means you could actually vomit up stool. So again, very rare, but people do vomit up stool. This does not necessarily mean their end of life. There's a bunch of other reasons why people could be vomiting up stool, but I'm specifically talking about at the end of life. Now, what can we do about it? There are things we can do. So there are a lot of anti-nausea medications we can give. Now, usually these people cannot swallow because every time they swallow, they'll just throw it up. So we usually give the medication rectally or sublingually to absorb in the gums. Those medications can work really well and take care of the problem. As a last result, we can always use an NG tube, which is a nasogastric tube that goes through the nose and down into the stomach. And then we put it to suction to decompress the stomach, and that takes away their nausea and vomiting. We don't like to do this because, one, it's not fun to put that tube in for the patient and then to have that patient keep it in. It's very uncomfortable, but sometimes they still want it because they'd rather have the tube in their nose than have this retractable nausea and vomiting. The last thing, and this thing is rare, is when someone could be like projectile vomiting blood. So why does this happen? Again, this is rare, but it usually happens with liver disease. With liver disease, you can get something called esophageal varices, which are in your esophagus. And they're like little bubbles that spring up in your esophagus that are, with any kind of pressure, could burst. And then on top of that, your blood is not coagulating correctly because your liver's not working. So you can bleed. You kind of, and then when this happens, you can throw up blood. You can be choking on blood. It can be violent, for lack of better words. I mean, it's hard to talk about. Most people don't like talking about it because of how it sounds. But it does happen, and it's important that we discuss these things. Now, as a hospice nurse, if I have someone who I know has esophageal varices or is at risk for them because they have liver disease, I will talk to the family and the patient about that risk, about, a really big cough or a really big sneeze, like something like that can trigger one of these two bursts. And sometimes if only one burst, it's not that big of a deal, but sometimes it can be it could be very bloody. And of course that freaks people out. So I always have families have the person lay on dark colored sheets and have dark colored towels in the room to kind of help clean everything up. It's not as gruesome because you can't see the blood as well because you have dark towels. This is something that if your loved one may have this, you should really work with your hospice team to kind of have a plan in place if this does happen. There is no easy way around this except for things like this. Just talking openly and honestly about the risks and what to do if this happens. So again, these things are rare. These are not things that always happen at the end of life, but they can. And if you are worried about this, you can always talk to your doctor or your hospice team about, is my loved one at risk for some of these rare symptoms? So again, just make sure you advocate for yourself, advocate for your loved one, and talk to your doctors, talk to your hospice team to get the best care. And don't forget to like and subscribe for more death and dying information.